This clip is sponsored by American Mobile. If you're a nurse interested in traveling, visit americanmobile.com to get started. What do you think are some, if you had to name some characteristics that make up a strong ER nurse for somebody that's maybe considering ER, making the change, or somebody in nursing school that's considering ER? What are some strong characteristics?
Wow. I think it's a little different for me since I started out in the ER many years ago,
Mm,
and all of those things, that all of the hard lessons that I had to learn, I kind of figured them out. And that was as a tech, but also, observing other nurses and how they did their serving nurses at the time, and how they did their job, and how they went about it, and the level of professionalism. And
mm,
but I think that you need to be able to ground yourself. That's the biggest thing, because things are going to happen around you, and you just need to be able to ground yourself, and be able to step up to what it is that you need to do.
mm.
Um,
Okay.
uh, yeah, I mean, those are the two biggest thing. I think being able to think quickly on your feet as well is another
Yeah.
one. Um, Being able to read your patients, being able to read the people around you is one of those things. Because you can sometimes sense more or less when a patient's going to go from being okay to being not so
Yeah.
okay, which can sometimes happen right away. And
Yeah, I feel like you can't
you need
assume
to,
in the ER. You can't just
yeah,
assume.
you can't trust your patients in the ER. Whether they look good, because sometimes they won't be looking good this minute you turn your back on them, right? So, and I mean that obviously jokingly, but yeah, you got to keep an eye on your patients, and you got to constantly you should be prepared to be on your feet all the time, constantly checking on your patients, which you and I both know that that's not what happens, right? We know
Yeah.
that, you know, some people just do the bare minimum, and they just kind of hang out, and it sucks because if you're one of these people that are constantly checking on your patients, rounding on your patients like we're supposed to, making sure that they're okay, and all you see are people just kind of sitting down, hanging out the whole shift. It's not fair to their
Yeah.
patients,
Well, and
right?
then those are the patients that are going to like unexpectedly, code because they're not being checked on. They're not being monitored. Whereas like,
Yeah,
the person that's
and there's
constantly
yeah,
checking on their patients, you're going to know your patients so much more. The continuity of care is going to be better